Sanders.
Thank you, Mr. Chairman. Mr. Vogt, when your budget or the President's budget proposes $1.5 trillion in cuts to Medicaid and $845 billion cuts to Medicare, when you propose that, you obviously studied how many people would die as a result of lack of access to health care. What conclusion did you reach? How many thousands of people do you think will die because of massive cuts to Medicare and Medicaid?
Senator, those numbers that you cited are not accurate. We do not cut Medicare by $850 billion. What that doesn't account for is the fact that we take things outside of Medicare, for such as uncompensated care, to non-Medicare beneficiaries. We move that outside of Medicare. We're going to still spend money on uncompensated care for non-Medicare beneficiaries, but when you adjust for the things where we put it back in other parts of the budget, there is no cut at all, because Medicare is going up each and every year, and also it's $517 in savings instead of the number that you cited. And there's a
well, it's going up every year in nominal dollars. I understand that, but you will concede that healthcare inflation is higher than general inflation. So if you're not even keeping up with healthcare inflation, it in fact is a real healthcare cut. I mentioned earlier the very alarming concern that hospitals have about the devastation these cuts will do for senior citizens. And when you cut $1.5 trillion, you're also not including in your calculations the fact that there are more people who will be in the Medicare program. I suspect Medicaid, despite the administration's effort, will continue to expand. But you did not answer my question. There are studies out there which suggest that many thousands of Americans die every single year because they don't get to a doctor when they should. Did you, in your calculations about massive cuts to Medicare and Medicaid, come up with any numbers as to how many Americans will die or maybe get sicker because they don't have the health care that they need?
We don't think any of those scenarios will result. In fact, we look at the current situation when we look at a tragic scenario where a young boy in 2007, 2008, DeMonte Driver, died because of the fact that he had a toothache because of the wait lines within Medicaid. And we say that's a fundamentally broken system. We want a different system. We want states to have more control over
with less money. You want to throw, look, this president tried to throw millions of people off of Medicaid. Giving a block grant to a state with less money means massive cuts in Medicaid. Let's be honest about what you're doing. Let me ask you this question. President Trump campaigned about not cutting Medicare, not cutting Medicaid, and he's making massive cuts to Medicare and Medicaid. What should the American people think about that?
This budget's title is Promises Kept, Taxpayers First, and for a specific reason. The president kept his promises to the American people in this budget. We do not cut Medicare, we do not cut Social Security, and we do not cut Medicaid.
All right, I would respectfully suggest that is a dishonest answer. I think that's absolutely inaccurate. It is unfactual, and you will have to explain to somebody, not to me, why the hospitals in this country are scared to death about the impact that your budget and President Trump's budget will have on them. Please tell me why it is a good idea to extend tax breaks for the wealthiest people in this country who are already doing phenomenally well, and then cut back on the ability of kids to get a college education or senior citizens in this country to stay warm in the wintertime. What is your logic about that one?
We think it's important that families be able to keep more of what is their own money.
And what percentage,
difference
the tax breaks that you guys passed last year, 83% of those benefits went to the top 1%. In fact, millions of Americans pay more in taxes. So what you are doing here is giving tax breaks to the wealthiest people who are doing phenomenally well. Then you're cutting back on education, making it harder for kids to get a college education. You're cutting back on nutrition programs. Do you really not have a conscience? Do you know that people all over this country, children, seniors...
We're not cutting back on nutrition programs.
Oh, you're not cutting back on the SNAP program?
We have reforms in the SNAP.
Oh, reforms.
Work requirement of a harvest box. We're not...
How much are you cutting back on these programs?
We have about $200 billion in savings from those.
Oh, savings, I see. See, to listen to these hearings, fellow Americans, you need to get a dictionary. Savings means cuts. Reform means massive cuts. Let's be clear what this budget is. This is a budget that benefits wealthy campaign contributors. This is a budget that goes to war against the working families of this country. This really is, in fact, a disgraceful budget, and I'm happy to say that there are going to be very few people, even Republicans, who will vote for this terrible budget.